What we are interested in doing is we want to resolve the withholding so the child doesn't soil. That's what we're trying to do. Withholding is not curable. It's not curable. You don't cure that behavior. Once that's ingrained, under stress and in a variety of situations, that child will withhold beyond normal withholding. We all withhold. If you need to go to the bathroom on the way home today from this meeting, you're not just going to go in the car. You withhold until you can find a toilet and appropriately go to the bathroom. What happens with stool withholders is they withhold, but then even when they're home, it doesn't matter. Even if they have their own bathroom, they're comfortable in their own house, they still withhold. So they never complete that task of when they get to a bathroom they're comfortable in, they still don't go. So that behavior is very, very difficult. What this program does is it resolves the withholding so that the soiling stops. And what we'll talk about is there's a 2-day period in which we empty the bowel. We'll talk about that. And then there's maintenance, in which we continue to work not to allow the withholding to recur so the encopresis doesn't recur. That's our job. But you don't cure stool withholding. So that when people judge a program based on whether during maintenance a kid is withholding and the idea that a child should never ever have another accident, that's not realistic. A child may have another poop accident, be encopretic occasionally, but our job running this program is to help you recognize when the withholding is recurring so that the soiling doesn't happen, and if the soiling happens, hopefully give you the tools to know what to do, certainly to be available on that given day so that we can talk, we can partner, and I can suggest how to get rid of it. So you do something for 2 or 3 days, you get rid of the withholding, you get rid of the soiling, and then we're back on track. That's how this program is different. I'm into trying to educate people as much as possible to empower all of you so that if no professional were around eventually, you will be able to observe your child and know what to do if withholding occurs or encopresis occurs. It's very important that you feel empowered to do that. When people sign up for the Dr. Dom program, I think that they expect that their child will be cured of the soiling of stool or encopresis. And what we make very apparent is that we feel that we can resolve that soiling so that that child will have a good self-image, will not be embarrassed socially. We make it very clear, and I feel very comfortable in saying that I don't cure stool withholding. Stool withholding that leads to encopresis, and we haven't talked about stool withholding, but stool withholding in which you behaviorally hold back stool until you can't hold it back anymore, and then you have a poop accident, that I don't cure stool withholding. What I do is I work to resolve it in the sense that if we can keep a youngster from stool withholding, that youngster will not soil stool. And that's our hope. There are 2 components to the program. One is the clean out phase that takes a couple of days, where our goal is to clean the intestine from all of that increase in stool. And then what we call maintenance, which really lasts forever. Maintenance means that by partnering with parents and teaching parents how to recognize when a youngster is withholding, that we can prevent further withholding and therefore prevent stool accidents. If we can do that, then we will have been successful.